Good morning, everyone, and welcome. Thank you so much for joining us here at the National Centre for Family Hub's webinar on parent and carer panels for services in the Start for Life period. It's brilliant to see so many of you here this morning. I know that some of you will still be joining, but we're getting through a lot today, so we're going to get started. I'm Bronya Arnott, Regional Implementation Advisor here at the National Centre for Family Hubs. Closed captions will be available today during our webinar, so please click on the closed captions button to enable these at the bottom of your screen. The chat function is disabled during the webinar, so if you have any questions for our speakers today, please put them into the Q&A function. There will also be the opportunity to upvote any popular questions that you would like to see asked. All presentation slides from today will be available after the event and shared with speakers and attendees. And the webinar will be recorded and available on our YouTube channel in the coming weeks. If you have any technical issues at all today, please do put them in the Q&A function, and a member of the training and events team will be able to assist you with these. For anyone joining us today for the first time, the National Centre for Family Hubs is an online resource hub and learning network that is funded by the Department for Education and led by Anna Freud, the UK's leading evidence-based children and families mental health charity. The National Centre for Family Hubs is designed to support the development and implementation of family hubs and to spread best practice, taking into account what families say they want and need, what local areas tell us about good practice, and what we know from evidence about what works. Moving on to the next slide, you'll be able to see that today's webinar is part of a rolling programme of learning events hosted by the National Centre for Family Hubs. Recordings and resources from all of our previous events are available on our website. We do have some upcoming events that you might be interested in. For example, we have a National Centre for Family Hubs induction session coming up on the 15th of February. This session will provide an overview of the National Centre, including the national policy context and our approach to working with local authorities across the country. If you would like to book onto this event or any of our future events, a link will be posted in the chat. You can also join our Family Hubs in Mind Learning Network to receive our resources. We'll share details of future learning events and other resources that you might be interested in. You can also contact us directly via our inquiries inbox if you have any queries. So, moving on to today's event. Today we will be exploring parent and carer panels for services in the Start for Life period. And we are joined by a brilliant lineup of our speakers to explore this topic. We are going to start with a presentation shortly from Alison Powell, Head of Start for Life Programme Policy. Our next speaker, Dina Kosharek, is a parent participation worker here at the National Centre for Family Hubs. And then we will move into a panel session and hear from speakers from 3 local authorities, Peterborough, Durham and Northumberland. And we will then have a Q&A session with all of our speakers before bringing the event to a close at 11:30. So if you have any questions or comments, please do remember to put them in the Q&A and we'll try and get to these when we have our Q&A session later on. If we don't get to all of your questions today, we will be collating a list of frequently asked questions, which we can share after the event. And now I'd like to give a very warm welcome to our first speaker, Alison Powell, Head of Start for Life Programme Policy. Alison, welcome.
Thank you very much. It's really nice to speak to you today. So like it's already been said, I'm the Head of Programme Policy in the Start for Life unit at the Department of Health. So my team cover a number of the funded strands from across the Family Hubs and Start for Life programme. So infant feeding, perinatal, mental health and parent-infant relationships. I also have responsibility for some workforce pilots, which is slightly separate from the main programme. And then I also cover Start for Life offers and, of course, parent carer panels, which is why we're here today. I think I've got about 10 minutes on the agenda, and I'm going to give a quick overview of the Family Hubs and Start for Life programme and its origins. I'm going to quickly run through the expectations we've set through the programme in terms of parent-carer panels, and then we'll think of some of the considerations when implementing a PCP. So next slide, please. So in terms of the origins of the programme, a few years ago, there was the Early Years and Healthy Development Review, which set out a vision to transform how families and babies are supported to get the best possible start in life. And through that review period, we heard that current services are often not designed and delivered in collaboration with families. So they're not ensuring that the families and babies' needs are met. And we know that those first 1,001 days, so that's from when a baby's born to when they're 2, are really critical, and that they're a time of rapid development. And babies' experiences during this time lay the foundations for lifelong emotional and physical health. And that's why we think it's really important to engage with parents and carers at the start of their journey to make sure we're providing the best possible outcomes for them and their babies. And we heard through the review that parents and carers really want the opportunity to work collaboratively with those designing services. And so the review recommended that local areas each establish a parent and carer panel for that Start for Life period to ensure that the voice of families is included in service design and delivery. Next slide, please. So then coming to the opportunity, at the 2001 budget, the government announced a package of around £300 million to transform services for parents, carers, babies and children in 75 local authorities in England. And as a civil service, I don't mind telling you that this was completely astonishing. So the money is intended to provide thousands of families with access to support when they need it. Not only is the funding intended to support the implementation of the vision set out in the review, but also to support the delivery of one of the manifesto commitments, which was to champion family hubs. So family hubs are intended to help join people up locally to improve access to services and help improve connections between families, professionals, services and providers. Next slide, please. And then from that £300 million budget, all of the 75 local authorities involved in the programme have been provided with funding to support them to establish parent and carer panels in their area. We published a programme guide for local authorities involved in the programme where we've set a series of minimum expectations for what we expect to see in all PCPs. So this includes that panels should be diverse and representative of local demographics. Panel meetings should be held regularly. Really, we're expecting that as a minimum every second month. Parents and carers should be actively supported to attend and contribute to panel discussions. So this might be by providing expenses, funding childcare, thinking about travel costs. There should also be an option for people to access the panel digitally. So this might be the case that you have some face-to-face meetings and some online, and they alternate, or however works for your, or some hybrid meetings, however works in your local area. And then finally, insights from the panel should be passed to the single accountable leader for the programme so that they can shape local service design, planning and delivery. Next slide, please. I'm going to slightly skim over this slide, but in addition to the programme guide, we also published some guidance for how to establish a parent-carer panel. This was actually written with all local authorities in mind. So although we're providing funding to the 75 local authorities involved in the programme, we think that all local authorities ought to be doing this. So set out some expectations and a number of considerations to help make PCP successful. Next slide, please. So firstly, the guidance talks about the importance of making the panel diverse. So to ensure as many voices as possible are heard, you need to consider how to create a welcoming and inclusive environment for all families. You need to give particular attention to those from diverse and underrepresented communities because they're the voices that are often unheard. So that might include doing some outreach work or peer support to making sure those underrepresented communities feel able to participate. We also encourage local authorities to ensure that around half of the panel members are fathers or co-parents. We also think that local authorities need to think about how to make panel sessions as inclusive as possible, and the guidance provides some practical considerations to help you do this. So thinking about the timing of panel sessions, I'm sure the parents and carers amongst us will appreciate that there's some times in the day that aren't very easy to attend meetings if you've got babies and young children. So it's important to work collaboratively with the panel to establish a suitable time for meetings. Think about the accessibility of locations. You might want to use your family hub as a venue, or change the location for each meeting. You should, as I said earlier, it's also important to think about holding the meetings online. You should also consider reasonable adjustments. So, for example, where you've recruited panelists who speak English as an additional language, it might be helpful to hire an interpreter for the panel. You should write accessible notes for people with specific learning difficulties. Consider covering travel costs, as that could be a barrier to hearing from those on lower incomes. Could also offer a creche service, or consider how allowing babies and children to attend the meetings, as some parents and carers might not be able to afford to cover childcare. Can also think about providing pastoral support. So as part of the meetings, it might be the case that some panel members share some potentially triggering histories when they want to, which they want to share. And it'd be really important to either provide them with support, or use some of the funding to think about how to provide support, or signpost them to where they might be able to access it in your local area. Next slide, please. This is my final slide. The guidance also provides some guiding principles for running panels. So we think it's really important to let members know what to expect and what they're signing up for. So you could think about co-producing some terms of reference so that panels feel comfortable sharing their views. You'll also want to manage expectations and explain that change takes time. So it might be the case that everybody on the panel and local leaders all think that one of the suggestions is really good and something that they want to take forward, but actually change takes time, and it might be the case that that suggestion takes a few months, maybe a year to set up, and that it might be the case that their baby might be out of that kind of 0 to 2 period by the time their services started to be implemented. You might have some panel members who struggle to have the confidence to contribute to meetings. It'll be potentially quite a new experience for many members of the panel. So you want to consider ways to help them to engage. So you could support them through training, and this is actually a good way to incentivize people to join the panel, as they'll gain some transferable skills. You could also think about supporting parents to help each other. So find ways to build peer support networks, give them a sense of ownership, think about mentoring schemes or a buddy system. It's also important to facilitate meetings inclusively. So, for example, you want to give the panel members information and questions in advance of the meetings, keep the agenda concise, so it's just 1 or 2 issues. And then finally, on feedback, you need to make sure that you're sharing insights with the local leaders who are best placed to act on that feedback. Panel members might want the opportunity to provide that feedback themselves, so supporting them to do that's really important. And then very finally, think about the feedback on the feedback. So and closing that loop, so that the panel knows what's happened as a result of their suggestions. So perhaps through You Said We Did posters, or getting local leaders to come and speak to them to explain what's been done as a result of their suggestions. Thank you.
Thank you so much for that, Alison. That was really insightful. Next up, our speaker, Dina Kosharek from the Anna Freud, is unfortunately unable to join us live this morning. So Dina has pre-recorded a video for us to watch about the Lundy model of participation, which I'm really looking forward to hearing about.
Hello, I'm Dina Kosharek, and I'm going to speak about the Lundy model and its application. I'm a parent participation advisor at the National Center for Family Hubs, which means I give the parents and service users view, and I'm an adoptive parent of 2 girls. The Lundy model of child participation was developed in 2007 by Professor Laura Lundy, who is professor at Queen's University in Belfast. Laura Lundy's expertise lies in international children's rights, and that's reflected in her model, which is a rights-based approach to child participation. The model is based on Article 12 of the UN Convention of the Rights of the Child. Lundy's model is very practice-oriented, and that's probably why it's been so widely adopted. You're probably all very familiar with this. I thought I put it up because the model is rights-based. Basically, Article 12 covers the child's right to express their views and their right to have those views given due weight. And that's, of course, highly relevant to participation. These rights apply also to adults, covered, for instance, by the right to freedom of expression. And so the Lundy model has also been used when working with adults. The model is based on 4 key concepts: space, voice, audience, and influence. The concept of space entails that people need to be given time and space and a feeling of safety to express their views. Voice means that people need to be given all the relevant information and any other support they need to voice their views. Audience means that the right people need to hear the voice. There's no point telling people who hold no decision-making power. And then finally, influence, which means the views must be taken into account when decisions are made. If all of these are covered, there's a good chance that participation will be successful, and by that I mean meaningful for participants and impactful. It's maybe worth mentioning here that children's, or in this case parents' carers' voice, is not the same as participation. We often use the term voice as a shorthand for Article 12, but that can reduce impact because voice does not cover the full rights. That's why Professor Lundy says voice is not enough. We always need to make sure that there's audience and impact. This is a different visualization of the model. Here you can see how the 4 key concepts link in with the rights of Article 12. As you can see, the elements have a chronological order. However, it's important to keep in mind that just because we create space, voice does not automatically follow. We need to create the right conditions to make sure that all elements come into force. To help professionals apply the model in practice, Professor Lundy, the Department of Children, Equality, Disability, Integration and Youth in Ireland, the Irish Child and Family Agency, TUSLA, and Habna Nog have created a number of checklists and tools which have all been user tested and adapted based on the feedback they received. This one is the planning checklist, which is a guide on how to listen to children and young people and how to involve them in decision making when developing policies, services, programs, governance, research, and legislation. Professor Lundy and these organizations in Ireland have developed a number of lists to support the practical application of the Lundy model. For instance, checklists for planning participation strategies, planning sessions, and the evaluation of sessions and more. The Everyday Spaces checklist, for instance, provides guidance to teachers, early years practitioners, social workers, youth workers, other adults working with children on listening to children and young people and on how to give them a voice. This list here, I thought I show another example, is for everyday situations, so it can be used in classrooms, hospitals, childcare settings, youth services, and other spaces, anything you can think of really. There are also evaluation and feedback forms. You can find all of these under the source link. These are all checklists with children in mind, but they can be easily adapted for parent-carer participation. For those of you who want to get a quick run through the complete framework and toolkit Ireland has developed, please have a look at the sources on the last chart. There's a YouTube link from the launch of the National Participation Framework in Ireland, and they've developed all these lists with Laura Lundy. I also wanted to make you aware of the planning tools for parent participation that TUSLA has created and published, in case you have not come across it yet. This toolkit includes a lot of ideas, tools, and checklists for parental participation that are all based on the Lundy model. The Anna Freud has a well-established participation department with several staff and many volunteers. Many of them have been volunteering at the Anna Freud for several years. Participation at the Anna Freud is based on the Lundy model. There are two groups of volunteers, parent champions and young champions, and all of them have experience with mental health and service use, either themselves or via a family member. Volunteers at the Anna Freud can progress into paid roles. They then become members of specific teams and projects. Volunteers engage in a number of activities. For instance, they feed back to surveys and research questionnaires or marketing materials. They take public speaking events or speak at conferences, panels, or videos. They write blogs, reports, or create video blogs. They co-deliver educational sessions. Some are members of specific projects or teams. For instance, we have digital champions and research champions. And they sit on interview panels to hire new staff members. And that really goes up to the highest levels. So, for instance, I was on an interview panel for a new psychiatrist, heads of departments, senior psychotherapists. It really goes across the board. The Anna Freud runs regular parent-carer panels with their volunteers. These will be different to those family hubs we'll be running, but I thought it might still be helpful to you to hear more about them because the panels are very well established and they run well. The Anna Freud is creating space by giving their volunteers long-term contracts so that they can get a thorough understanding of the organization and get to know different teams at the Anna Freud. The Anna Freud is a big organization, so I think that's an important aspect. And due to that, they feel more confident to express their views. The participation team culture is very supportive, and staff and volunteers have trusted relationships. We parent volunteers engage in many different engagement opportunities, not just panels. I've just mentioned some. The panels are a way of getting all parent volunteers together if possible, so everyone knows each other, and they're an easy way for professionals to get feedback or ideas from parent volunteers. Panels take place online or in person. Voice. Usually volunteers have the expertise they need in order to engage in the activities, because we're all service users, or directly or indirectly. The goal is to give our views as service users, and as I said, we all have experience of that. We give feedback on research projects, surveys, leaflets, and share our expertise with professionals to help improve services. Audience, researchers and project managers join us at the parent care panel so we can give feedback directly to the relevant people. Sometimes this can lead to further engagement. For instance, if there are open questions, the researcher or project manager might meet a second time with some members of the panel. And influence is usually fed back via the participation staff. So we are informed on what's been decided and if our feedback has been acted upon. And sometimes we see the effect of our input in the wild. For instance, I've recently seen a survey online that I've given feedback on, and that's nice, of course.
Thanks to Dina for recording that presentation for us. We're now moving on to the next session, in which we have 3 local authorities here to talk to us about their experiences. As part of this session, I would like to welcome Fran Macklin from Peterborough, Family Hub's lead officer. From Durham, we have Alison Gent, Family Hub's development manager. And from Northumberland, we have both Helen Lancaster, senior projects and development manager, and Emma Shields, participation and community development lead. Welcome to you all. I think Fran's going to kick us off first.
Good morning, everyone. So I'm Fran Macklin. I'm the Family Hub's lead officer for Peterborough City Council, and I'm project managing the development and rollout of the Family Hubs programme across Peterborough City Council and some of our rural areas. And I've come to talk to you today around parent participation and some of the methods that we use in Peterborough to get our parents to engage with the Family Hubs programme, its development and ongoing sustainability. Next slide, please. So we have a model, and it relies on three really key words: participation, partnerships and communication. And the little picture there I've put on the side there is our launch day last year, where parents actually designed the launch and decided what they wanted to happen on the launch day, and they were able to plan with us the event that we did and who was coming to the launch as well. And the ribbon was cut by 3 of our children alongside our mayor and mayoress. Next slide, please. So our model is really, really simple, and it's a really key thing to how we work with families across the Family Hubs programme. So parents are participating already in Family Hubs groups and services. So it's really important that we engage families that really know about what we're trying to achieve, but also what their hopes and desires are as well. So it's really good to have them as part of the parent participation. Our parents are our partners, so and they co-produce the development of the Family Hubs programme with us, and we use partners just as we would use the same term for our professional partners in the sense of the organisations that work alongside us developing the Family Hubs programme. And parents also are our key communicators of the programme, and communicating with them is really vital. For example, we are running immunisation clinics for measles at the moment, so we're doing MMR top-ups, and what we did was we put out on social media where the clinics were going to be and asked parents to share them, so that they went as far and wide in every group and social media account that they could access, so that we could get that information out to all families, so that we would get a better take-up of the MMR in particular, which we're not very good at the moment within Peterborough. But the point is that we use our parents to communicate to other parents, but also to share their examples of where things have gone well, where they haven't gone so well. We really encourage them to be vocal and to be able to share what they want to share, whether it be positive or negative. Next slide, please. So how do we do this? So we don't use just one method for talking to our parents and getting them engaged in the programme. We have parent carer panels, which are run through our child and family centres. They're very successful. Parents attend them either online or face-to-face. And usually each time there's a parent carer panel, there's a particular theme that's been chosen by the parents that they want to discuss and find out more about. But also they're able to form actions for us to have a look at what we can do to help resolve any particular issues that have come up or improve services as well. We also run online parent focus groups. So, for example, we have a digital focus group that is helping us develop our digital offer in Peterborough. So we have parents that join us that look through some of the web pages, some of the journey that you do when you're trying to find information online, and how can we improve on that? How can we make it much more accessible for all families to see? We do a lot of online parent surveys through social media. They're very successful. We usually do polls, and we will send out links to things like Microsoft Forms, and we get very good feedback from parents from that kind of method. It's a really easy way for them to do very short surveys, not very long surveys, usually 10 questions or less, but we do tend to get a really good response rate. We also go into the Family Hubs groups and sessions as well to talk to parents on a one-to-one basis, but also as part of maybe some group discussion. We also encourage some of our partners also to go in and talk to parents about some of the services they run, so that they really get to meet all of the people that they might come in contact with through the Family Hubs programme. We also hold parent carer events. So we held one in November, which I've got a short film to show you at the end of the presentation, where we invite parents to come in with their children. We offer refreshments and play sessions, but also we have a focus on particular things that they want to discuss with us. We sometimes film them. We also get them to kind of form action plans for us and help us with what kind of gaps or barriers that they might be experiencing that will help us improve services. So obviously we have one-to-one conversations with families as well, because not all families feel comfortable in a group kind of setting. So if a family wants to contact us, we have a really kind of open way of talking to people. We don't want people to feel judged or feel that their opinion isn't valued, because actually what we want is for this really good kind of two-way dialogue between us and the families. The child's voice is really important as well. We hear that quite often when we're talking about early help and targeted support and social care. But actually for us, even though our children that we're working with in the main are under 5s, we still do talk to them about the groups and sessions that they're in. Do they have fun? Are they enjoying it? What are the best bits? But also as part of the wider offer, we are talking to children older than 5 up to 19 as well about their experiences accessing services and groups, and what kind of things would support them in their development and growing up, and where do they need help. We also link with a lot of our partner organisations. So in Peterborough, we've got a really active community with lots of different types of community groups that happen, but also community projects. So we go along to those community events, and we go along to community projects, and we sit and talk. We ask if we can come and share information on the Family Hubs programme. We also take back any kind of feedback that they might have from an experience that they've had, or we support them in actually accessing support if they need to as well. So it's a really good way of kind of getting our message across, but also being able to then access families that we might not access necessarily through the Family Hubs in the buildings. We also have recruited a parent peer coordinator to engage parents from minority families and to link into these community groups. And their role really is kind of twofold. So they go out and make those links with quite a lot of groups of families. So Peterborough, for example, as I'm sure many of your areas are, is a very diverse area. And so we have got an awful lot of non-English speaking families, but also we've got a lot of families that come from different cultures where there may well be hesitancy in accessing something that's seen as statutory or official. So what our parent peer coordinator is doing is going in and breaking down those barriers really, and actually having conversations with them about how they are really valued within the community. And actually we really want them to share their experiences with us, the barriers that they might be facing, but also maybe trying to develop services to be able to deliver them to be more culturally sensitive, but also actually meet the needs of that community as well. So it might mean that we talk to other partners and professionals about actually adapting some of the ways that we deliver things so that they are more accessible and maybe a little bit less intimidating to them sometimes. So yeah, it's a really active way of kind of engaging with every aspect of the community within Peterborough. Next slide, please. So finally, I've got a little film here to show you, which is one of the ones that we did in November. This one's on positive experiences in the family hubs. We also filmed at the same time a film around barriers as well. And then we also filmed some feedback from the children, but we've just popped one in for you because otherwise you'd be watching forever.
Thank you, Fran, for a really great presentation and a lovely video at the end there as well. We'd now like to invite Alison Gent to come on and tell us about Durham's journey.
Thank you, Bronya. Good morning, everyone. My name's Alison Gent. I'm the Family Hub Development Manager within Durham County Council. I'm just going to share a little bit about our journey with our parent carer panel. Next slide, please. So we started our journey really back at the end of 2022 because we had a really clear goal that we wanted our parent carer panel established and meeting from April of 23. We've done all sorts of feedback and consultation in Durham, but co-production was kind of a step beyond what we'd done in the past. So we commissioned some support from Charlie Waller Trust in terms of guiding us with the process of setting it up. And what they said is that if we wanted to do it in co-production, we needed to do that from the start. So you can see there we had a little flyer that we did. We did some workshop events where we invited practitioners to come along and to bring a parent carer with them. And during those sessions, we kind of pulled together the information in terms of what they felt we would need to make a parent carer panel successful. Next slide, please. So we actually held 3 workshops. There's 2 on the flyer. We did do a 3rd one after that. And the professionals came from a range of agencies, some of whom are outlined there. And it gave us, it was like a double opportunity. It gave us an opportunity to share information about family hubs and what they were right at the very start of us launching them in County Durham. But it also gave us that opportunity to speak to those parents about what was important and what were the key things that we needed to look at in terms of making a parent carer panel a success. Next slide, please. So these were some of the things that they came up with. So that we talked about the must do's, the absolute things that we had to have in place to make sure that this worked. And it was things like varied representation, actively recruiting from lesser heard groups, a mix of parents and professionals. They did want some professionals on there so that their voice was directly heard. Short regular meetings, face-to-face and virtual, jargon-free, involvement payments and covering expenses, and the you said we did, and feeding back if we couldn't do it. So if there was something that they wanted or that they were suggesting and we absolutely couldn't, that we still took that back to them and explained why, so that they still felt listened to, but that we explained why. So we've done these things. We recruited based on all the things you never really recruit on, to be fair. So we looked at a geographical spread across the county. We looked at making sure we had younger parents and older parents. We knew some of them had told us they were a foster parent or an adopted parent. All those demographics that usually in recruitment you don't see were the things that they told us to use. We do have some professional representation on there as well. And we actually meet twice monthly, but it's the same agenda. So we have a daytime meeting in person and an evening meeting on Teams. That's an identical agenda, but it gives parents two opportunities in which to come. So for our parents who are back at work, they will predominantly join on an evening. But it's whatever suits them. And we very much operate that you said we did in terms of feeding back. So most meetings will start, in fact, with that. So this was what we talked about with the last one, and these have been the resultant actions from it. In terms of the may-dos, they asked us for visits to the family hub. So we rotate our meetings around the sites. Social events where the children and families are welcome. So we did something in the summer, and we did a pre-Christmas event where they brought their children with them. You know, they spend these times in meetings and they talk about their children sometimes, but we actually had the opportunity where they could bring their partners and their children together to meet. More dad-focused activities, and we've recently recruited a dad's coordinator to look at that. And we've linked them with other parent carer groups. So where we are an EPEC hub in County Durham, empowering parents, empowering communities. And when we've done our social events, we've joined with our EPEC parent group leaders for those. We have a WhatsApp group where they contact each other in between meetings. And if there's something in between meetings that we need a quick response on, we might put a poll into that group for them to quickly vote on, and we provide nice biscuits. The things that they said we absolutely must do was restrict it to only online. So they wanted that option of the in-person or online. They didn't want venue bias, both in terms of how we recruited panel members, but also where we met. County Durham is quite big. You can drive for an hour and still be within the county. So we do move it about. They wanted clear boundaries. They didn't want it to feel tokenistic or not balanced opinions, and they didn't want us to not follow up on what they said that we were going to do. They wanted it to be meaningful and listened to. Next slide, please. So in terms of recruitment, overall for the parent carer panel, we recruited a worker to lead on this. So we have an engagement and participation lead. So we created and recruited to that post. She came into post March of 2023. We then, part of one of her first tasks was to work with the information that we'd gathered from the workshops to write some role descriptors. So these were essentially like job descriptors based on some of the things of the must-dos, but also we asked them about skills and qualities, both of a parent carer and of a worker who would be involved. And from that, we drafted these role descriptors. We then pulled a fourth workshop together where we shared these drafts with the parent carer, with the people who'd come to that workshop, to gather feedback on it and made some adjustments to it. There were a couple of things in there they didn't think were clear. There was some discussion about some of the wording that we'd had on it. So again, we made some further changes to the role descriptors based from those. And we also shared with them the application form, if you like, the expression of interest form that we had for people to in. Once that was agreed, we shared that on our Facebook page, and we asked our staff and the people who'd been in the meeting to share that as well. We received 63 applications to be part of our parent carer panel, which we were absolutely overwhelmed by. We had no idea how many we were going to receive, but we were really pleased with the response that we got. So we went through a shortlisting process that, as I mentioned, was kind of different to any other shortlisting process I've done, in that we very much looked at where people lived to see if we had the geographical spread across the county, and those things such as the I suppose your protected characteristics that you would never normally consider, because that was what they told us to do. We then carried out some, Helen, who's our engagement and participation lead, carried out some telephone interviews with the people that we'd selected, and we recruited 20 to our panel, and we held our first in-person and online meeting on the 5th of April of 23. Next slide, please. So this is just it's a couple of photos from our meetings. So as you can see there, we've got our in-person and our online. And in the middle photo, you know, as Alison Powell alluded to, sometimes we have children who join us in these meetings. They're never a distraction in terms of their behaviour. They're just usually a distraction because they're so lovely to see, and it's nice to have them there. But for that mum, it's quite a little one there, who's feeding him herself. She wouldn't have been able to attend if she hadn't brought him. We will also pay for childcare costs and travel costs for parents to attend the meetings. So again, we've paid nursery fees for additional sessions if people have needed them in order to be able to attend. And then we've got our a little quote there from one of the professionals who's involved in terms of the motivation and the engagement. And they do keep us grounded in what matters to them. They are a very critical friend, and they are very honest in their feedback in terms of what they share with us. Next slide, please. So we have our terms of reference there, you know, into frequency of when we meet. We have our agreement, and the bottom of the right-hand photo where there's the pictures around the text, that was the pictures of our parent carer panel, which went into our first Family Hub newsletter that we produced just before Christmas. Next slide, please. So in terms of our journey so far, every box here represents something that the parent carer panel have been involved in. So we've had 10 meetings. We have 2 co-chairs, one who's available during the day and one on an evening, and they attend our Family Hub steering meetings, which are made up of the managers across the services. So we have representation from the PCC into that. They were very much involved in the Start for Life leaflet. So when we produced our hard copy of our Start for Life offer, they overlooked that for us. And there was some of the wording in there that they fed back on, but also some of the pictures that we'd put in the texts. In amongst it, we had a picture of an outline of an expectant parent where the baby was in the tummy, and what they said is, but what about dad, or what about an adopted parent, or what about someone going through surrogacy? So we changed that to a picture of someone thinking about a baby, because whatever route you become a parent, they are in your head and you think about them. We've included them in the recruitment interview, so the last round of recruitment for the local authority staff who were based in the family hubs. We had a member of the parent carer panel on the panel, and they also drafted a question that they wanted to ask. They've been involved in for our Send I Ask drop-ins and our Grow and Healthy drop-ins. They were involved in the format of those, the frequency of which that they take place, whether or not people would want them in it more often, but in a location they had to travel to, or less often and more local. And they said less often and more local, and that's what we've gone with. Our family peer supporter roles sit within our health visiting service, and their role is very much about like that hand holding. They will support parents to attend groups, they'll do wellbeing walks, they sit as part of our perinatal mental health offer. And it was a new role into the service that we funded through the family hubs. And what they were talking about is that generally our health staff wear a uniform. And our parent carer panel said they really didn't want these staff to wear a uniform, because if they were taking a parent on a wellbeing walk, they didn't want it to look like they were out with a worker. They wanted it to look like they were out with a friend. The person who comes from the health side into these meetings took that back to their managers, and what they agreed is that they have a coloured T-shirt, so it has no branding on. So they do all wear the same colour for uniformity, but it's not an actual uniform. So if a parent is out with one of those staff, it's not obvious. And what they said is that the voice of the parent carer panel was absolutely the key in getting that agreed. It would not have been agreed without that parental voice in there. And then the thing that they've done that I think I'm most proud of is they presented at our stakeholder event. So if you can just go on to the next slide, please. So at the back end of last year, we held our third stakeholder workshop, and at the photo on the left there, we have a mixture of staff, but there is a member of our parent carer panel sat on that table included in the discussion. And the photo to the right is our Helen, who's our engagement and participation lead, and two of our parent carer panel with their information stand sharing about what they've done. And then if we can just move on to the next slide. And then they spoke to a room of about 130 people. I was very pleased I didn't have to follow them, because they absolutely stole the show. Their passion in terms of their role in us shaping services, talking about how listened to they felt, but also the difference it's made to them personally and the impact it's had on their lives, and the confidence that they've gained through their involvement was just amazing. There was staff coming to me afterwards saying they felt quite emotional hearing them speak. They were brilliant. Next slide, please. So just some feedback in terms of our parent carer panel members. I'm not going to read all of them because I'm conscious of time, but I think it's been adapted to my needs. It assures me the hubs will be wonderful to see suggestions being taken on board and implemented in as little as few weeks. Some of the things they're suggesting aren't massive things, but they do make a massive difference. And the one on the bottom right, the logo that sits behind me on my team slide, my background on Zoom, and on the bottom of the slides, our logo was co-produced with parents and carers prior to the parent carer panel being set up. But one of those parents is part of the PCP, and she was thrilled to see that thing that she'd been involved in was then part of all of our marketing and branding material. Next slide, please. So I think in terms of what we've learned that co-production takes time. There's quite often people will come to me and say, Alison, can the parent carer panel have a look at this? And I'll go back to them with feedback, and they'll go, oh God, it's going to take us a while to do that. And they're absolutely receptive to the feedback, but sometimes they will see the detail and things that we never spotted. I think for us, that involvement in the parents and carers right from the start of the parent carer panel absolutely helped us get it right and had their engagement and buy-in. The involvement payments, when we talked to them about it, they all said that they didn't want it. It wasn't what was motivating them to get involved. But actually for us, it was about valuing their role in the service. So we do pay them for their time in meetings and we cover their expenses. We're being flexible. We're actually in the process. We've been, for the past 10 months, we've always met on a Wednesday, and one of our parents has changed job and they've said, is there any way we could change it? So we're going to alternate between a Wednesday and a Thursday each month. Always think about whose voice we're not hearing. So for us, this was dads and the Gypsy Roma traveller community. So the GRT community is the biggest ethnic minority group in County Durham. We're not a hugely diverse local authority area. And this is who we've targeted recruitment out. And we do now have a representation from the GRT community. We've got a young dad who's getting involved in the panel. We did already have a couple on there, but we wanted to even up the ratios a little bit. And we're in conversation with a granddad who's a kinship carer about coming on board as well to, again, give that different experience of being a parent. We offer wellbeing support to our members as we would staff, so they get a phone call every month to see how they are doing. And that it can't all be yes people. One of the workers found it really hard listening to someone be critical of the service they've received from us historically. But actually, if we only hear from people who say we're brilliant, we will never change and learn from that. And next slide, please, which is my last one. So next for us, we're looking at Mystery Shopper to gain feedback from the service. So our parent carer panel will be involved in that. We're developing user journeys to share family experience. We're currently evaluating our panel process. So we've done an anonymous survey. Do they feel listened to? Do they feel valued? They've been helping us draft a survey that will go out to our wider families who we work with and who we don't. We're going to involve them in what they think is important for the training and induction of our staff. We're refreshing our membership by the end of March, so our annual refresh, but very much targeted recruitment in terms of who we're not hearing from. We're looking how we more formally gain feedback from children and young people, although we do it through our work, but formalising that process. And we're very proud that we have 2 or 3 members from our parent carer panel who are going to be involved in the Start for Life Parent Advisory Group on a national level as well. Thank you very much.
Thanks for that, Alison. Great to hear from you. And I think now we are going to hear from Helen Lancaster and her colleague Emma Shields.
Hello everybody, my name's Helen Lancaster. I'm the Senior Projects and Development Manager at Northumberland County Council, and I lead on the development of family hubs, amongst other things. So we're going to talk about our approach to developing parent carer panels. And I think what's really nice is that we work closely with Durham as part of our regional group. And Durham is a similar local authority to Northumberland, and they've taken a different approach to us. So I think that's one of the strengths about this webinar today. It shows that there isn't a kind of one size fits all, and you have to do what you think is right for your local authority area. Next slide, please. So you may have seen, if you've seen us before, because we're always hanging around, you might know the Northumberland context, but basically we're a huge county. We have a small population in relation to the size of the county. And 54% of our communities are classed as kind of rural, and nationally that's 17%. So it just gives you an idea of the vastness of the county. We have lots of different history in Northumberland. We have a lot of industrial towns and villages. We also have a lot of farming and agricultural work. And so because of that, the people within Northumberland, the communities are very diverse, and often they won't really mix. So they'll have their own community. Some are very close-knit, others not so much. So that's the kind of context that we're operating in. And I just wanted to, before I hand over to Emma, who's done a great job and who's really led this bit of work and put lots of things in place, I just wanted to kind of lead in with saying we were one of the 75 local authorities who got the funding. So we were in a very privileged position to be able to fund a lot of capacity in this. And so when Emma starts presenting our next slide, you will see that we've put a lot of investment into a community development team and Emma, who can support not only the family panels, but also some wider community development work, which I felt was really important in Northumberland. So with that, I shall hand over to Emma. Thank you.
Thanks, Helen. So obviously across Northumberland, we do have 11 purpose-built buildings and 7 dedicated outreach centres, as Helen mentioned. The diverse area that we cover, it means that in some of our areas, we do have to move into more rural. So we have a lot of settings set in fire stations, military bases and primary schools. Next slide, please. So our journey, as Helen mentioned, started with the recruitment of 4 community development workers and myself. We identified our existing parent and carers who initially joined us through the family hubs. And we started those conversations at quite an early point with our practitioners and our family help staff members to try and identify families that we already worked with. From the earliest point, we started getting our families engaged with what they wanted the groups to be called, how they were going to be involved in our group, and quite quickly we looked at setting up our family panels. Again, due to the rural setup of Northumberland, we did have to look at setting more than one group up. So we ended up where we've got currently 9 family panels running, and the first session started in June and July. During those times, we had conversations with our families about what they wanted to be called, because we thought, do they want to stay PCPs? And quite quickly, they wanted to identify themselves as a group, and they decided that they wanted to be called the Northumberland Family Panels. So our family panels were asked to give information around different pieces of work. They were consulted whether or not, as Alison mentioned earlier, did they want payment. They just wanted to be included. They didn't want a payment for coming along and giving their thoughts and their views. They just wanted to feel as though they belonged to something. Once we were up and running, we decided then we wanted to launch our programme, and we launched it in September gone, and we decided to put a bit of a media campaign behind that, which our family panels were very involved in, and we looked at that refer a friend, and our family panel members, if they referred somebody, they received a £10 voucher. Again, they were a bit like, okay, that's fine, but they just wanted to be part of the wider picture. Next slide, please. So this is some of the information that we shared on our social media campaign. As you note in the top corner, this is the actual picture that the actual family panels decided on. They were very vocal in wanting to make sure they were called family panels, because they felt they're not just parents. We have carers, we have kinship family members, we have grandparents, and they didn't just want to be a parent-carer panel. They wanted to make sure they were inclusive of everybody that was coming along, and that's why they decided on the family panel logo. So this is the social media campaign that went out across all of our socials, Twitter and Facebook, and our family panels were very instrumental in sharing this with their families, friends, and so on, and larger community members. Next slide, please. So we decided on looking at the governance and oversight. So we have a Family Hub implementation group, which is our senior managers, and then our family panel members. And we feel in Northumberland, it's really vital that we get those messages in that two-way flow. So we looked at the induction process, terms of reference, and two-way flow of feedback. Next slide, please. So with regards our induction, it started off where we kind of had informal chats with our members, and it was decided very quickly that we needed to have an induction process for these families that are coming on board. And we started our induction process this month. So we have had groups up and running, but it's been very kind of low level. We've had them involved in our website development and some of our leaflets and information. But we decided it needed to be more formal, so we did an induction process. This was designed with the individuals in mind, and the family panel members were very involved in this process. And we looked at kind of the family hubs and local authority approach to make sure it was very bespoke for our parents and carers involved. Next slide, please. We do have a terms of reference, which was produced, and that included our key aims, objectives, and structure. For example, how often we meet, who was involved in those, and it also highlights very clear expectations of both the attendees and the staff involved, just to ensure we have some seamless running of the panels. And we also ensure that we have set agendas just to make sure the families are aware. And as obviously discussed with our other members and local authorities, we make sure that we have that co-production involved in that. But it is very linked to what the wants and the desires are of our family panel members. So if we do have some of our partners wanting to talk to our families, it's really important that the families feel that they are included in that, and we're not just inviting people along for the sake of it. Next slide, please. So with regards our two-way flow feedback, as part of the panel agenda, we regularly seek the views and thoughts, obviously, of all of our members. And what we do is we make sure there is that two-way flow of information. We look and we encourage our family panel members to give us the feedback on the information that we need with regards our service development. But it's also really important that we're getting that two-way feed of what is needed from the family panel individuals. So we had a lot of discussion around opportunities for training for our families as well as our communities. And it was highlighted quite early on that they wanted some along the lines of first aid awareness training and so on. So in order to ensure that we're getting that flow of information and we're kind of listening, and it's not a tokenistic approach to our families, we very much introduced the first aid training and awareness, as well as the induction from quite an early on. And obviously, as you can see there, we put out our regular You Said We Did. And that's just to ensure that our families feel as though they are included in that two-way flow of information from our strategic members right down to our family panels, because they're instrumental in moving our service forward. Next slide, please. So what's going well? So we currently meet monthly. It tends to be term time only. We should have run only for an hour, but our parents get so involved in the sessions, it does tend to go over. We do have agenda points which are set, and they are linked to our locality family hubs. Some of our family panel members do meet virtually. And that's due to the limited transport options that we have across Northumberland. So we have a virtual offer as well as a face-to-face offer. I do have to say our families do prefer the face-to-face offer rather than the virtual. So that's why we do have 9 groups currently meeting. We also have 2 new groups that are waiting to start, and they'll start in February. And currently, from the established groups, we have regular attendees across 4 localities of 47 members currently. And that's just a bit of a breakdown of some of the members that we have. We also, I'm quite excited to let you all know that we have a fathers group that is starting. We do have dads within our family panels currently, but we have a dads only group which has come about because dads have specifically asked for a fathers group to run. Next slide, please. And I think we kind of now need to be thinking about what we're reflecting on and moving forward to our next steps. So we are looking at obviously widening our membership to make sure that we get our seldom heard groups from across Northumberland, and we're doing that by working with our needs assessment, which we've currently just recently completed. We're looking at effective management of personal agendas. We have had some issues with regards kind of families coming along, and they're very obviously they want to share their thoughts, their feelings, their views, and get their points across. But sometimes we do have to be very clear that if it's their own agendas, we have to look at that wider scope and what all of our families are in need of. So we are very keen on making sure that if somebody does has a personal agenda, it's important that we share that, but it's also important that we address that separately. So we will speak to our families outside that. As I mentioned earlier, we started our induction process, and I'm really, really pleased to say that all of our panel members want to become volunteers of Northumberland County Council. So we're starting that process of getting them signed up as volunteers. Which includes their DBS and obviously virtual training. We are about to progress on to looking at parent champion models, just to kind of have our voices heard of our families who are more specific and wanting to volunteer within our hubs. We want to continue to develop our panel members in areas they wish to explore. So a couple of our family panel members want to join the implementation group to have that parent voice at a more senior level. So that's amazing. And then we need to consider sustainability post March 2025. Next slide, please. Oh. We thought we'd crack this and move this up. So sorry, a little bit more about what was going well. So obviously we have our family panels very involved in our family hubs, and we encourage that positive feedback. But again, we also are aware that there are areas of development which we need to work on. And we have very broad shoulders because our family panels are very honest with the feedback that they provide. We do our you said, we did. And we have opportunities for wider partners, again, to gather views and opinions. And they do that through an expression of interest form. We do seek key themes. So depending on what is happening across our localities, we will concentrate on those. And we have a lot of cross feedback from our health partners around resources that they're using. And as I mentioned, we're obviously looking at progressing on to our parent champion model. Next slide. Oh, thank you.
Brilliant. Thank you so much, Helen and Emma. And sorry for the issue with the slides there. Could I welcome back now Alison Gent and also Fran Macklin, so we can have a bit of a Q&A session, because there are some questions coming in our Q&A. And it's been really great to hear about your really sort of vibrant parent carer panels. I think that's something that's come across to me, that they're all really vibrant. And yeah, it would be good to sort of ask to people to have the opportunity to ask questions. So there have been a couple that I know have been answered, but we might do a bit of a deep dive into those depending on what time we have. But Fran, there's a question for you in the chat from Kate about who leads on engagement of the parent carer panel in Peterborough, and do you provide questions to ask the parents around feedback from commission services, or is it the panel solely parent-led?
So we have a parent peer coordinator post, which is employed through the local authority as part of the Family Hubs programme. We have a core team of 4 of us that kind of work from the local authority, and then we work with all the organisations that we kind of support within the programme. And their role is to engage with families and to get them involved in the programme. So they will spend time out in the Family Hub centres, but they also, as I said before in the presentation, they go out to other community events. They'll do stands. They will go and engage with community groups that maybe we haven't had as much engagement from, and we want to kind of increase that. But the parent carer panels themselves are purely parent-led, so we have facilitators in there, and we do have professionals that join the parent carer panels as well to kind of help with the conversation and be able to answer questions maybe straight away. But the parents decide on the agenda. They decide on what questions they want to focus on and what areas of work that they want to have a look at.
That's brilliant, thank you. We've got lots of questions coming through now. Let me just see what's next on the list. Somebody has asked about sort of, the confidence of, new panelists sort of joining parent carer panels. And I guess obviously that's something to think about as you come up with your refresh. A lot of your panel members will have had possibly lots of confidence in the activities that they've gained, but what happens, sort of with people who are less confident and maybe joining sort of those new established groups? I don't know who wants to take that.
I don't mind coming in on that. I think one of the things that it's one of the things that we're looking at the minute, because we kind of thought some of our panel would go, I've done my year and I'm going to step back, and actually they don't really want to. So our refresh is quite minimal. So therefore we've got a small number of people coming into quite a large established group. So what we've started having a conversation about is how we do that. So thinking about group work theory. So we're going to go through a storming phase, but also what is it that we can do to aid that. So I think if those new parents are able to come in person, it's probably a bit easier. I think it's harder to, some of them prefer the online option because it works for family life, but I think in person is always easier to do that. You know, and it may be some stuff around a few icebreakers being put in there in terms of you're just making sure they know each other's names as much as anything. Because, you know, we've had really good attendance over the past 10 months. So those who have attended have come along well. I think in terms of the confidence, it was interesting. We've just shared something in our last meeting with them about some marketing stuff that we're doing. And the daytime meeting went, yeah, that's all right. And then the evening meeting, one of our young parents who generally has been relatively quiet went, I don't like that. And I went, okay, what don't you like about it? And she was dead honest and she fed back. I said, have you got an alternative? And 4 other people in the meeting went, yeah, we agree with her. And one of my comments after was actually how much she's built in confidence through this process. Because 6 months ago, she'd have probably just nodded and agreed with us. So I think the confidence is probably built from they know that we listen, so they feel that it's worth speaking out. I think the bit about the new members is going to be the bit for us to manage. We need to look at whether or not we're managing that online or in person and how we go about that.
Thank you. Helen, did you want to come in on this as well?
Yes, I was just going to say, I think rather than just focus on new participants, I think it's important to recognise that in every group you do get those parents who will dominate and who will give their views and who will lead the discussion. And I think that is very much a skill of the member of staff or whoever might be supporting those panels to kind of make sure everybody is given their chance to shine almost, and invite those members who don't say a lot or who might be new or who don't feel comfortable. But I think, like Alison said, I think face-to-face really helps that. And there's also something about the culture of the panel that you are building. You know, you want to understand, you want to make sure panel members understand that it's a community and they should welcome new people. But I definitely think there's something about the skills of the people supporting those meetings.
And can I ask you about, you've all mentioned sort of, you know, involving voices that are sort of less commonly heard, and just about, there's a question about how you go about encouraging those sort of seldom heard voices in your parent carer panels. Does anyone want to come in on that?
Yeah, it has been difficult, really difficult to engage with some of our seldom heard groups due to the fact that they don't feel comfortable to come along. They might not feel as included in the community as they probably think they are. So what we've done in Northumberland is we've gone along to a lot of their kind of closed network groups to introduce ourselves, for them to see that we're okay. They can come along. We do tend to go outside of the hubs as well to talk to families, to talk to individuals. Rather than just saying come to the hub, it can be quite kind of a scary process. So we do go directly to them, to somewhere they feel safe, they feel secure, to build that confidence up, to then invite them across. And we do, as I think it was Alison mentioned, we don't do all of our panels within our hubs. We can do them out in the community as well. So it's making sure we are going to them almost and then inviting them into us after that.
Brilliant, thanks Emma. Fran, did you want to come in?
It was just really to say, I think it is flexibility. I really agree with what Emma's just said, actually. You know, we can't expect families or parents to come to us. We have to go to them, and we have to go into the communities that they live in. For example, we have linked with a project called the Durham project, which we're funding now a couple of pieces of work with them around supporting Muslim mums in particular to access perinatal mental health services. Now, what's come from that, which has been really fantastic, is we've got a group of Muslim mums now really engaging in the Family Hubs programme and sharing their experiences with us, so that we're learning from them about what they perceive is good, what they perceive is bad, but also how can we improve that kind of cultural engagement with those groups of families that wouldn't necessarily look to us as their first point of call for support, because often it's the wider family network the community direct. So, and they've done some amazing work within the project, working with these mums and dads as well. They've been doing some groups and sessions for dads, but they've put together a course for them. So these mums, and it's called Connecting Muslim Mums, and they're basically building those links for them into that wider community and bringing them out of, but also destigmatizing some of the things that are possibly sort of things that would be barriers to them accessing services through maybe the Family Hubs programme. So yeah, definitely flexibility is key.
Thanks, Fran. And Alison?
I think as well for us, we've where someone's been coming in new, so our the Gypsy Roma traveller rep and our young dad, they've come with a worker. So although because everybody else joined at the same time, but for these, and we've asked the worker to kind of stay relatively quiet in the middle of the meeting, so that there's not an additional, we're not like unbalancing the parent carer professional voice. But I think for some of them, just having that person next to them for their first few meetings has helped them to attend. So again, where that's been something that will be beneficial, we've allowed that to happen as well.
Fantastic, thank you. Can I ask if any of you have had any success in hearing from sort of very young children? I know some of you sort of mentioned that sort of desire to hear children's voices as well. Have any of you found any methods successful for sort of hearing from very young children?
We've actually just been talking about that. It's in a managers meeting yesterday. So there's an organisation in County Durham called Investing in Children, and they're a human rights organisation, and they have, I suppose it's like a kite mark, it's like a practice standard around engaging in dialogue with children and young people. And it's something that as a local authority, all our teams, we have Investing in Children status. So they come out and they visit us. We've had it a while, so where every other year they come and see us, and they ask for evidence of that. And one of the examples that was given, and it's a very low level example, but was at the toddler group where the kids were having a chat about the fact that they don't like pears and they want cucumber. So they're going to have cucumber instead. And I was like, what a lovely little example. But actually, even at that, it's a really simple thing. But when you're 3, life's relatively simple, usually. So that was I think for us as well, it's been in moving from our buildings, which were children's centres, into family hubs. The visual, so the aesthetic of our buildings, so our rooms that were predominantly set up for younger age ranges, actually what does our furniture look like, what colours do we have on the walls, what artwork do we have. So we've worked in a lot of our buildings for our groups that we deliver for school age children and teenagers on what do our buildings look like, so that they feel welcoming and they don't feel like they're walking into a children's centre that runs a group for them. They feel like it's a building that's welcome for them to attend as well.
Thanks, Alison. Helen?
So we've done various young people's consultation, and we did Emma can tell you more, but we did a huge consultation with like 8+ and parents of 8+ children. I don't think that we've cracked a kind of panel approach necessarily to collecting children's feedback. However, that's kind of next on the list in terms of our development of this approach. And actually more widely across children's services. I mean, children's voice is always so important, but there's another big push on that. So yeah, let's watch this space for that one.
Brilliant, thank you. Lots of questions coming in for you. People have asked about sort of particularly those, and I know Northumberland, you said, you know, that importance of recognising that there's a variety of family members who might be involved in these, and that's reflected in the name of the panel. Can anyone say particularly sort of about those members of the families who are sort of not sort of direct sort of parents, but are more sort of caregiving roles or other roles, about how they've been involved? And, you know, sort of connecting them with the parent carer panels or family panels.
Is that with regards our kinship members and things that, yeah. So we have we have 2 current family members that are caring for their grandchildren. They've attended a number of times, and I think it was just to get their point of view across as well, the fact that, you know, they're coming along to our sessions in our family hubs, and sometimes they do feel like they're kind of sitting on the outside looking in. And I think in our inductions, especially over the last couple of weeks, we've really highlighted the fact that our panels are open to everyone. And we've made sure that our panel members think about who it could be open to. So it's not only mothers, fathers, it's aunties, it's uncles, it's grandparents, it's foster carers. So again, we kind of need to look at that seldom heard group, because kinship isn't very widely thought of, and I think we need to be making sure that everybody understands that we're there for everyone, and we open our panels to everyone as well. But yeah, currently we have 2 kinship family members that come along, and they've been very vocal with what is on offer in our family hubs and how they can be involved in that process.
Thanks, Helen.
I noticed that Adrian put in a specific comment around parents whose children are not primarily in their care, and I don't know whether she wants to clarify what she means, but that to me reads that of parents who might have had children removed from their care, or does it just mean the co-parent who the child doesn't primarily live with? If it's children removed from families, we don't have any parents on the panels in that respect. And I've just been thinking through that question actually, because we would have to tread very, very carefully with that, because that could be very triggering to a parent whose children have been removed, because the discussion is largely based around children in their parents' care, and children attend the sessions. Certainly in Northumberland they do. So yeah, it's a really difficult one, that. But it you know, we do need their views. We do need them to help shape services. But yeah, it's a difficult one.
Okay, thank you. I wondered if any of you could say more about the sort of skills that are needed in terms of your sort of engagement and participation workers and leads who you've sort of recruited or sort of have on board.
I think it's them being open, them listening. I suppose it's a lot of the skills that come with working in this field of work anyway. So that they're not taking the challenge personally, because, like Emma said, our parent carer panel are very vocal, and they will absolutely tell us we are at the point where they will be brutally honest with us, if they don't like something, or they think that it's worded badly, or we haven't come up with a good idea on things. But I think there is also that challenge about approaching it, you know, not judgmental. We have an absolute mixture in terms of the parents that are represented on the panel, from a range of different backgrounds, and that caring approach, like I said, Helen rings them all once a month in between, or if one of them's been in a meeting and she just thought something's not right, you normally talk and you haven't been, she'll get in touch with them the following day and check on them and make sure they're all right. I guess how you would with your staff. If you noticed a member of staff wasn't their usual self, following up on that.
And Helen?
I definitely think it's they have to be tenacious, and they have to be. It really helps that we've got Emma leading this approach, because she is she's got a true community development background, and it just needs to be people who are just willing to kind of muck in and meet parents and carers on their level, whichever level that may be, and however they're approaching things, and just being really flexible. The other thing that I think is quite important, and has happened in Northumberland, it's like Alison's mentioned, they are very vocal, and some of the feedback it's quite hard to hear. And I think it's helped that our community development workers, they sit within my team. It's kind of helped. It's helped, and it's hindered as well in some respects. But they sit in my team, so they're almost like removed from operational delivery, because I manage the project team. And so in that respect, they don't feel like they need to hear that. It's almost not personal at all. However, the community development workers, including Emma in that, they have had to have some uncomfortable conversations with operational staff members, who can be defensive. With the best will in the world, they're trying their absolute hardest, and when they're being told that things maybe aren't working, it can be hard to hear. So yeah, very much think somebody who can kind of bridge that gap and, you know, work between is really important as well.
Fantastic, thank you. We are coming to the end now, so we haven't got much time for questions, but we have heard from who said they're not one of the 75 areas that have had the funding for Family Hubs and Start for Life. So if you had one top tip for them, for their parent carer panels, you know, what do you think that would be?
I would say you probably need a little bit of dedicated time, even if that's not a full post. I would say start small. I would say you probably don't need to have an all singing, all dancing recruitment campaign. What you need to do is talk to the families who are already accessing the hubs in the first instance. So start small and build up, but you probably do need some capacity, even if that's just kind of, you know, 2 days a week or something. Initially, that would be my advice.
Okay. Anything from you, Alison?
I was just going to agree. I think look at the feedback that you gather from what you're currently doing, and use that and share that across services. So what, you know, share that learning. But ideally, I think having the dedicated time to it is absolutely been key for us in terms of making it successful. It is that person's priority, so it won't slip on the agenda.
Brilliant, thank you. Yeah, so that's been a fantastic, really interesting and informative session. We are coming to a close, but I just want to say that the slides will be shared from today, and there will be a recording of the session on our YouTube channel. We are producing a new case study today on parent carer panels, which should be shared with you. The case study focuses on Durham, so if you've got any questions around their model, you might be able to find out more in that resource. But yeah, as I say, we are now coming up to 11:30, so I just want to say a huge big thank you to all of our speakers today, and also thanks to those of you who have joined us this morning in our audience as well, for taking your time out of your morning and also for your great questions for our panel members. Thanks to our amazing training team in the background, Rachel, B and Paula, who've worked really hard behind the scenes, and my National Centre colleague Shruti, who's also been helping out. At the end of the webinar, you will be redirected to a survey form. Please do fill it out. It will help us to shape our future events. And don't forget, you can book onto our upcoming learning events via our website, and also sign up to our learning network to receive our newsletter. But thank you very much, and I look forward to seeing you again soon. Thank you.